It is October, which is Breast Cancer Awareness Month, and at Top Doctors, we are interviewing some of our leading consultants. Today, we have Mr. Jaroslaw Krupa, and he will be speaking with us about male breast cancer and sharing with us some information that we would like to know. So, Mr. Krupa, would you please just introduce yourself to begin with and about your field and whatever you'd like to share with the audience about you?
Yeah, thank you for the invitation. As you mentioned, I'm oncoplastic breast consultant, breast surgeon, and I work at University Hospitals of Leicester and NHS Trust, and I'm also an honorary senior lecturer at University of Leicester. My main field of interest is related to breast cancer, breast reconstructive surgery, oncoplastic surgery, and cosmetic surgery. So that's why I want to talk today about breast cancer in men.
Okay, wonderful. Well, we really appreciate you being here with us today. So the first question for you is, how can you tell if a man has breast cancer, and about what percentage of breast cancer cases are in males?
Yeah, so there is a common misconception that breast cancer can only affect women, and that's clearly is not the case. Unfortunately, men can also suffer from breast cancer, although it is obviously much less common. In the UK, we have about 55,000 women and 350 men diagnosed every year with breast cancer. So men account for about 1% of all breast cancer cases. Diagnosis of breast cancer is usually based on so-called triple assessment, which consists of three components. First will be clinical examination, and the second will be some imaging tests like ultrasound scan or mammography, and the final will be a tissue biopsy. So the actual, obviously all three components are important, but the final diagnosis is made on analyzing the tissue from biopsy.
Okay, thank you. Next, we have, what are the early stage symptoms men should look out for?
So the most common symptom of breast cancer in men is a painless lump, and that arises in about 75% of cases. So pain and the lump is present in only about 5% of male patients with breast cancer. Also, cancer can invade nipple quite early. So often we see change to the nipple, which could be retraction, could be change the shape of the nipple discharge, or ulceration. Some patients can also present with lumps in the armpit, which could be enlarged lymph nodes. And there is also a rare form of breast cancer called Potter's disease, which can look like an eczema. So there's a whole range of symptoms which can be relevant. I've got a picture actually to share with you of the patient who had a Potter's disease. As you can see on the left-hand side, this is the same patient. On the left-hand side, his nipple is entirely normal. On the right side, it is early breast cancer and looks like an eczema. So these symptoms can be sometimes fairly wide range of symptoms.
Okay, that's had no idea. Very informative, actually. Thank you for that. And our next one, what is the average age of men when they're diagnosed with breast cancer, and why so, do you think?
So we know that when we get older, the risk of developing breast cancer increases, and that applies both to male and female patients. Look at the average age of men diagnosed with breast cancer. It is around 67 years of age, and it is about 5 to 10 years later than average age of women diagnosed with this disease. This is obviously a very indicative figure. This is not exact science. We have patients who are much older or much younger. We see patients who are in the late 40s. So there's a range of factors involved here, but usually men present later than women.
Okay, that's good to know. Good to know. What does how does the treatment differ in men versus women, and what is the survival rate in men versus women?
So the treatment of breast cancer nowadays is very individualized and personalized. So we obviously have various forms of treatment available, and that could be surgery, chemotherapy, radiotherapy, hormonal treatment, immunotherapy, so-called targeted therapy. And most of our patients will have a combination of these treatments. But actual decision about individual patient is based on the type of cancer and stage the disease at presentation. There are obviously some differences between men and women, and surgery is a good example. So in women, the most commonly performed operation for breast cancer is so-called lumpectomy or breast conserving surgery. That's when the cancerous tumor is removed with a margin of healthy tissue, but the rest of the breast is preserved. Now, in contrast, in men, this is rarely possible. That is because we have much smaller size breast, and also tumors very often involve nipple quite early. Therefore, we are forced to perform more extensive operation called mastectomy, where whole breast tissue is removed. So the other forms of treatments are more or less similar and available to our patients. In terms of survival rates, so if you compare the survival rates for men and women in terms of breast cancer, and if you compare the same age groups and same stage of disease, the outcomes are relatively similar. So there's no significant difference here.
Okay, it makes sense, and but with the explanation, it definitely puts the pieces together. And I don't know if many people actually have thought about that and were aware. So thank you for that explanation. It's very thorough. Our next question is: breast cancer in men hereditary, and what percentage of the population is diagnosed with breast cancer?
So this is an important topic because we know that breast cancer can run in a family, and that applies both to female and male patients. If you look at the statistics, about 20% of men with breast cancer will have first-degree relative with breast cancer diagnosis. So this could be a mother, sister, or daughter. And there are also some specific genetic mutations like BRCA1, BRCA2 mutation, which can significantly increase risk of developing breast cancer. So if you look at the statistics again, the lifetime risk of developing breast cancer for men in general population is in the range of 0.1%. But if you have a man with BRCA1 mutation, the same risk will be 12 times higher, will be about 1.2%. For BRCA2, it will be 70 times higher, up to 7% lifetime risk. So this is very important also to remember that these mutations can be passed on to generations, and the BRCA mutation carrier has 50% chance of passing this mutation to his children. So we are now routinely referring all male patients with breast cancer to genetic clinic for testing in order to detect this early and obviously prevent early cancer presentation in other patients in future.
Yeah. This is important. Like you said, this could save lives. Now that we have.
That's correct, and we see a lot of patients now undergoing preventative surgery. I mean, Angelina Jolie was a good example, and she's a gene mutation carrier, BRCA gene mutation carrier. So by knowing that you have mutation, you can actually take action. You can go through preventative surgery, which is a very effective way of preventing cancer.
Yeah, amazing. We're getting closer and closer to beating. And our final question for you: what is your best advice to men to prevent and catch signs of breast cancer?
So obviously there's a lot of information in media about cancer prevention, and we all know that healthy lifestyle is important here, particularly maintaining a healthy weight, as obesity is one of the well-recognized risk factors for breast cancer. I think the main message for all men would be, just check your breast from time to time. If you notice any new symptoms like lumps, nipple discharge, change the breast shape, or nipple retraction, please don't ignore it. Don't hesitate. Go to see your doctor. And breast cancer in men is a very treatable disease with good prognosis, but specifically if it's if it's detected early. So the message is basically look after yourself and don't ignore your symptoms, I think.
Brilliant advice, and something we can carry into other aspects of our life. I mean, absolutely. And thank you so much. And is there anything else you'd like to add?
No, thank you very much. I think it's really good that you're doing this action for October as a Breast Cancer Awareness Month, and I hope that will raise awareness. So thank you for inviting me today.
Thank you so much for being here. And for anyone who would like to make a consultation or to learn more information, you can go to Mr. Jaroslaw Krupa's profile on topdoctors.co.uk. Thank you so much.
Thank you.